This is Riri Talk. Don't forget to hit like and subscribe.
Today, we will talk about the plastic surgeries that the members of BLACKPINK may have had, based from the opinions of plastic surgeons and cosmetic surgery workers have said. First is the oldest, Jisoo. Personally, for me, I do not think that she has had any work done. She looks the same for me pre-debut and even now. In fact, I consider her as the most natural beauty in Blackpink. However, the cosmetic and plastic surgery experts say otherwise. Here is what a plastic surgeon expert said. I would say that Jisoo has had cantoplasty and blepharoplasty. She has probably reshaped her eyes by taking out fat from her upper eyelids and lifting and tightening the outer corners of her eyes. Her eyes are bigger and she has noticeably less fat on her upper eyelids. Jisoo has also had an epicantoplasty where she lifted the inner corners of her eyes to make them more youthful and brighter. Her eyes are also elongated. I also think Jisoo fixed her nose to slightly point outwards, since Koreans greatly dislike upturned noses. The expert even said she definitely has enhanced her double eyelids. It is very rare for someone to naturally have Jisoo's extremely even and puffy double eyelids that she has now. Her eyes before are her eyes like Rose's right now. So for Blackpink Jisoo, do you agree with the plastic surgeon expert? Moving on is Blackpink Jennie. Like Jisoo, I also do not think that Blackpink Jennie would have had any surgery. I think she is actually natural as well because she looks the same with or without makeup. However, the plastic surgeon expert have said otherwise. Here is what they said. Jennie has had a cat eye lift. Like Jisoo, she has had a double eyelid surgery and her eye shape is wider and longer. She also has had lip fillers. Now, Jennie's nose clearly looks more pinched at the center. I also think that Jennie slimmed the tip of her nose, which is called a nasal obstruction rhinoplasty. When she smiles, it's more obvious because the tip of her nose looks very thin and pinched compared to her nostrils. Do you agree with what the plastic surgeon expert have said? Like Jennie and Jisoo, I also do not think that Rose has had any surgery. Let's now move on to Blackpink Rose. Having monolids while young and then having slight double eyelids when older is actually very common with Asians and it happens naturally. With this, it seems like the plastic surgeon expert agrees with me since she is also not sure whether Rose has had any eyelid surgery or not. Here is what the plastic surgeon expert have said. Rose has had a double eyelid surgery and a blepharoplasty, which is taking fat from the upper eyelids. Now, sometimes double eyelids do naturally occur as you grow older, so I cannot confirm for sure that Rose has gotten double eyelids through surgery, but judging from her pre-debut photos, Rose has had a lot of fat on her upper eyelids, like a lot, so it would have been harder for her to get natural double eyelids. Also, Rose uses double eyelid tape because her double eyelids are in different places. The plastic surgeon also added that Rose has definitely had rhinoplasty. The tip of her nose is less bulbous and her nostrils are slimmer and they point upward. It is obvious that Rose has had a chubbier face before. She probably had a buccal fat removal or a lip liposuction which slims down round cheeks for a slimmer face. Rose's face is noticeably longer, slimmer, and her jaw is way more defined. Another way to see if someone has had a buccal fat removal is when Rose has probably also had genioplasty or elongating the chin. Because comparing her photos, her chin is longer now than it was before. So for the plastic surgeon, it looks like Rose gradually made her nose slimmer and taller, which is also called as reduction rhinoplasty. So what do you think? Then, moving on to BLACKPINK Lisa, which is also the group's youngest member. In some angles, I personally think she looks similar to her younger pics, but in some angles, I do not. But here is what the plastic surgeon expert have said. Right away, we can tell Lisa has had rhinoplasty. Lisa has slimmed down her nose bridge, made her nostril slimmer, and made the tip of her nose less bulbous. Like Jisoo, Lisa has also had epicantoplasty, which is lifting the inner eye corners. Notice how we can see all of Lisa's pink tear duct, unlike her pre-debut days. And she also has had a cat eyelid. She also got an eyelid surgery to enhance her double eyelid. It also looks like Lisa reshaped her wool lip and got lip fillers. The plastic surgeon also added that Lisa lifted the corners of her lips and got lip fillers. Her eyelids used to be quite hooded and square, the plastic surgeon said. And she also continued that now her eyelids are prominent and her eyes are very almond shaped but not square shaped. So this is the conclusion of the plastic surgeon expert. She said that all of the BLACKPINK members have probably had plastic surgery. Apart from their individual surgeries, she also thinks that all four of them has had minor skin whitening injections such as glutathione, lipotoxin, ascorbic acid, and so on. Surgery or not, BLACKPINK is beautiful. If they feel more confident now than they were before, then I applaud their decisions to go for surgery. So what do you think?